Do your knees feel stiff, locked up, especially after you've been still for a while? Or when you get up from bed, or from a chair, and it feels like you need a few steps before they loosen up? A lot of people think that's just part of getting older, or that there's not much they can do about it. But there's one important detail almost no one explains to you. In many cases, it's not a lack of movement. It's a lack of mobility and preparation before movement. And that's why today I'm going to show you 3 simple stretches that can help reduce stiffness, improve movement, and relieve pressure on the knee, especially after 60. And stretch number 1, which I'm saving for the end, is the one that makes the biggest difference for your knees in everyday life. So stay with me until the end, because I'm also going to show you a very common mistake that makes a lot of people stretch their knees the wrong way and end up making the discomfort worse without even realizing it. Before I show you the stretches, let me explain something important. As a physical therapist, one of the most common complaints I see is exactly this feeling of knee stiffness. Do you feel that too? Comment below, I do. That way I can get to know you better. And a lot of people interpret this as a lack of movement or even as inevitable wear and tear. But in practice, what often happens is different. The knee joint depends on mobility and good gliding between the structures around it in order to function well. When you spend a long time sitting or standing still, those structures become stiffer and movement stops happening with the same ease. That's why, when you start walking, your knee feels locked up or heavy during those first few steps. From a physiological point of view, movement also helps distribute the synovial fluid inside the joint more effectively, which is responsible for nourishing the cartilage and helping it function properly. When you go too long without moving, that process slows down and the feeling of stiffness tends to increase. That's where stretching comes in. It's not just there to stretch the muscle, but to restore mobility, improve the quality of movement, and prepare the knee for daily activities. And when this is done the right way, movement starts to feel lighter and more comfortable. And if you want to learn how to take better care of your knees with simple and safe exercises, subscribe to the channel. Because here I always share practical guidance, especially for people who want to stay active after 50, 60. Now let's get to what matters. Stretch 3. This one looks simple, but it makes a big difference for the knee because the ankle is directly involved in the movement. And when it's stiff, the knee ends up compensating. You can do this exercise standing, with support, or sitting down. If you're just getting started or feeling more sensitive, the ideal is to do it standing while holding onto a wall, chair, or countertop for extra safety. The position is like this. Place one foot in front and the other behind, as if you were taking a small step. The front foot stays fully flat on the floor and the heel cannot come up. From there, bring the knee of the front leg toward your toes, slowly, only as far as feels comfortable, and then come back. That is the main movement. You'll repeat that back and forth a few times, always with control, without forcing it. After that, keep the knee slightly forward in the final position and hold for about 30 seconds, feeling a gentle stretch in your calf. One very important detail here is not letting the heel rise. If the heel comes off the floor, you lose the effect of the exercise. From a biomechanical point of view, this movement improves ankle mobility, which allows the knee to function more smoothly and with less compensation during walking and other activities. Do 8 to 10 repetitions and hold for 30 seconds at the end. Stretch 2. This one already starts to release an area that directly affects the knee, which is the back of the thigh. When those muscles are tighter, knee movement tends to feel stiffer and less fluid, especially when walking or getting up. Most people do this stretch standing up, but I want to avoid balance issues and falls. So the position is simple. You're going to sit on a sturdy chair and extend one leg out in front of you, keeping the heel resting on the floor. The other leg stays bent, with the foot flat on the floor as usual. From there, lean your torso slightly forward, as if you wanted to bring your chest closer to the thigh of the extended leg. The most important point here is posture. Avoid collapsing forward with your back rounded. Ideally, keep your spine more aligned and lean your body forward as one solid unit. You should feel a gentle stretch in the back of the thigh without pain. If you're not feeling anything, you can lean your torso a little farther forward. If it feels too intense, reduce the lean. Hold that position for 15 to 20 seconds. Breathe normally, and then come back up slowly. This stretch helps improve mobility in the posterior chain, which allows the knee to move with less tension and more control. Do it once on each side, and you can repeat it twice if needed. Stretch 1. And this is the one that makes the biggest difference for a lot of people, especially for those who feel discomfort on the outer side of the knee, and very few people know about it. Because there's a structure called the iliotibial band, which runs along the outside of the thigh and directly affects how load reaches the knee. When that area is tighter, it can increase pressure on the outer side of the joint, especially while walking. The position is lying down. Lie on your back with one leg extended on the floor and the other raised. To help, you can use a towel, strap, resistance band, or even a bedsheet looped around the foot of the raised leg. First, keep that leg extended upward, with the knee as straight as possible within your comfort range. From there, move that leg slightly toward the opposite side of the body, as if you were crossing just a little past the midline. The most important point here is to keep your torso stable. Don't let your body rotate along with it. The movement happens in the leg, not in the whole body. You should feel a stretch along the outer side of the thigh and not directly in the knee. If you feel it in the knee, reduce the range of motion. Hold that position for 15 to 20 seconds, breathe normally, and then return with control. This stretch helps reduce lateral tension and improves how the load is distributed through the knee during movement. And many times, just improving that balance is enough for the discomfort to start easing. Now let me show you a very common mistake that a lot of people make when stretching the knee, thinking they're helping. It's that classic quadriceps stretch, done standing up, pulling the foot back. This is one of the best known stretches, and it's not forbidden. But the problem is in how it's done. A lot of people pull the foot back too hard, bend the knee too much, and try to force the stretch. And that can increase pressure inside the joint, especially for people who already have pain, sensitivity, or some wear and tear. When you bend the knee too much, you compress internal structures. And when that's done forcefully or without control, it can irritate the area even more. Another very common mistake is thinking that the more you stretch, the better. But with the knee, too much force in a stretch can have the opposite effect. Instead of helping, it can increase pain afterward. So the point is not to stop stretching. It's about doing it the right way. A much safer way to do this stretch is lying on your side, like in the image. In this position, you have more control, less compensation, and you can better adjust the intensity. You hold your foot, bring it back carefully, until you feel a gentle stretch in the front of the thigh without knee pain. And keep your hips more stable without letting your body rotate. This way, you work the muscle without putting unnecessary pressure on the joint. So remember this. Stretching isn't about force. It's about control. And when it comes to the knee, less exaggeration usually brings better results. Now, an important message. In this video, we talked about stretching, and it can help a lot when the knee feels stiff, locked, shortened, or uncomfortable when starting to move. But when it comes to knee pain, strengthening properly is even more important than stretching. Because beyond tension and stiffness limiting movement, muscle weakness is one of the main things that overload the knee in daily life. When the muscles don't support well, the joint ends up doing more work on its own. And that's where a lot of pain begins or keeps coming back. So think of it this way. Stretching helps improve mobility and makes movement feel lighter. But strengthening is what truly provides support, stability, and protection for the knee. That's why the two complement each other. But strengthening remains essential. And if you want to understand which exercises are best for that, here on the channel, I have a video explaining exactly the most important exercises for people with knee pain. I'll leave it here on the screen because it's definitely worth watching. Now, another important note. It's always good to remember that the causes of knee pain can vary a lot. Not all knee pain is the same, and not every knee will respond in the same way. So if there's no improvement, or if the pain is getting worse, it's essential to see a doctor to investigate and diagnose the cause. And also a physical therapist to recommend the most appropriate and personalized treatment for your case. This makes a big difference, because when you understand the source of the pain and get the right guidance, the process becomes much safer and more effective. And if you want to go beyond stretching and follow a more structured plan to strengthen your knee safely, I've left the complete program in the first pinned comment. There, you'll find a step-by-step guide to improve strength, control, and stability without feeling lost. Now tell me in the comments, which of these stretches are you going to start with first? And if this video helped you, subscribe to the channel. That really helps me keep bringing you straight-to-the-point content with safe and practical exercises for anyone who wants to move better after 50, 60. See you in the next video.